Preterm birth is one of the leading causes of infant death here in the U.S. and globally, really, and it's more common to see this happen in pregnant women of color. It's a really troubling trend here. And joining us now live is Dr. Elizabeth Shiro. She's the president and CEO for the March of Dimes, with how her organization is trying to address this crisis. Doctor, thank you so much for joining us this morning.
Thanks for having me, Melanie.
Now, when a child is born before 37 weeks of pregnancy, what is their chances of survival? And if they do survive, what kind of long-term complications will they likely have as they grow up?
Yeah, Melanie, it'll depend on the gestational age, right? And so for survival overall, the earlier or more severely premature, the harder and the bigger the fight, right? Their skin is translucent, their organs are all there, but not developed. And then as you get, you can imagine at 36 weeks, much more developed and has more reserve, right? Because of that weight gain. But think about the long-term impact of a premature infant on lungs, eyes, brain, every organ system, to be honest. And so long-term lung issues are probably one of the most common. And then it's all developmental when it comes to the brain. And so, and these are vital organs for the rest of that child's life. And so the impact and how that, over their lifetime can be tremendous.
And why do you think Black and Native American women are 54% more likely to have a preterm birth as compared to a white mother would?
Yeah, so these are numbers that, we've been trying to amplify for some time. This report card we put out every year, right? Just like you give any child a report, it's a benchmark to show you how you're doing and where to improve. And these are the places that we have to improve. Black and brown women are doing worse in this country, and we're not focusing there. Think about if we had solutions there, that specifically, first of all, we'd do it, right? One and done, but it's a little more complicated than that. But if we could solve for that, we solve for all women. And specifically, when you look at Black and brown women, I think about access to care. So really getting in for your prenatal care, as well as having to manage those chronic conditions like diabetes, like hypertension. Those are things that really impact a pregnancy and a preterm birth. And so when we start looking at that, that's part of it. And then it's clearly a racial issue within our healthcare system. And we've got to fix that. And that needs more trust. And that needs more attention and solutions.
The disparity is so evident lately nowadays. I mean, you just look at the statistics and it's right there. I do want to talk about the Premature Research Expansion and Educate Act for Mothers that is currently in the process right now, and the work that March for Dimes is doing to help with this.
Yeah. So the PREME Act actually testified over the summer on this, is really expanding research into prematurity. I've been doing this for almost 30 years of delivering babies. We don't have a lot of solutions. We can diagnose, and then what do we do? So we need more testing. We need more real therapies that are effective and that work. And so that's what this is expanding. It's also really looking into research as well as education. So you're getting out to moms, families about prematurity so that they know they're at risk, like if you have twins or triplets, if you have had premature birth before, if you're a smoker, hypertension, diabetes. These are all things that are risk factors. So we're diving into a lot of that with this PREME Act. The PREME Act also really helps the reauthorization into looking at data into the morbidity and mortality review committees at every state level, which we think is super important to dive into the data.
Absolutely.
Yeah.
Dr. Elizabeth Shiro, thank you so much for educating us on such an important issue. We so appreciate your time, and happy holidays. Have a great rest of your holidays.
Thanks so much, Melanie. I appreciate it.
Bye. 8:18.